It is a wet day in Okitipupa, a rural community in Okitipupa Local Government Area of Ondo State, southwest Nigeria. And the When in Need team of medical professionals are determined to set to work. Okitipupa Local Government Area derived its name from the Yoruba word, the red-soiled town on the hill. It is made up of 7 districts, all of whom are gathered here at the St.Mary's Primary School to be a part of history in the making. The villagers have gathered in their numbers as the rain is not deterring their desire to get adequate medical care. Before settling into the community, Chetachi and her pilot team stopped by the chief executive of the state and the traditional ruler, who both gave nods and endorsements to this initiative.
The king of this village welcomed my team and I. mean, the hospitality is priceless. You can quantify the hospitality we received from the king of this village. And the visit with the First Lady went well yesterday. I was able to express to her what the When in Need Foundation does and what motivated me to start the When in Need Foundation, and to let her know that we're not politically inclined. You know, we believe that everyone is the same. We're all created by one God.
When we're in the palace, the king, you know, was like, he's happy because of the coordination we have.
The young, the old, and the physically challenged have come with the hope that their cries will be heard. "55-year-old Ade Omakere was born crippled. He can hardly be noticed among the crowd of people gathered, but with just a touch and high expectation, his life is set to be turned around.
Look, he's got a wheelchair.
As he is wheeled away amidst cheers and shouts of appreciation from other villagers, he recounts how his faith has led to this dream come true.
I'm disabled. That is why I stand for him.
As we were walking and saying hello to everybody, we saw this man sitting on the floor, and all he did was just to get our attention and told us that for 50-something years he has not walked. So luckily we have wheelchairs with us to donate, and I just took one of the wheelchairs and gave it to him.
And what did that moment make?
Incredible, you know, happy that I was able to help someone who has not freely moved around to be able to move around now.
The man that they gave the wheelchair to, you know, he's been working on his feet, and today, alhamdulillah, due to When in Need, he has a wheelchair. I just hope and pray that he will not sell it and go back to the floor, you know.
While treatment is being administered, educating the people on managing their health can go a long way in prevention.
Now, when you have a high blood sugar, it can lead you to so many other conditions. For example, it can just go to your eye and cause the person to have blindness, they call it retinopathy. Secondly, if the person has any wound on the legs, it will not be able to heal very fast.
The Wayne team of nurses are busy checking the vitals. Blood pressure, check. Heart rate, check. Body temperature, check. The World Health Organization Vision 2020 is being given a boost here at this outreach, as optometries and opticians are carrying out comprehensive eye checks. And ensuring that eyeglasses and other medical aids are provided to help correct failing sights and eliminate blindness. With lots and lots of medication, the makeshift pharmacy is the last stop for every patient attended to. It is a beehive of activity as the pharmacists sort drugs and package same for the long queue of patients outside. There is love in giving and sharing, and Chetachi Ecton, the brain behind this initiative, knows that only too well.
Everybody have their own callings. My calling in life is sharing and impacting lives, helping those that are not able to help themselves, giving to those that really don't have anything, sharing with the many that doesn't have much. So that's my goal, and I believe that's the path that God has set me on this world for.
Chetachi and her team believes sharing goes beyond politics, religion, or race. It speaks the message of love.
If you cut my skin, cut your skin, cut anybody's skin, it's the same color of blood. So we're just one man, one God's creation. That's why we're here, blessing the people of this community and this state.
It's not a political thing. You can see that there is no political rally around. There is no banner. There is nothing. It's purely giving back to the humanity.
With so many potential beneficiaries left unattended to, the exercise extends to a second day. And with a new day comes greater expectations. The numbers double while the physically challenged came in their numbers. 69-year-old Patrick Ejiofor worked as a security man in a financial institution. In 2008, he developed pains in his legs. He was then diagnosed for rheumatism, then diabetes, and later arthritis. With this misdiagnosis, his condition worsens. Every little wobbling step he takes, pains shudder down his spines. He is here today, hoping to get respite in this painful condition, a relief he got at the When in Need medical outreach.
What worries me most is to walk.
Patrick Ejiofor, Friday Ukuni, Talabi Idiogbe, and 15-year-old Olume Bright are among the dozens of beneficiaries of various kinds of walking aids. As the outreach program winds up, the team carried out one more essential exercise: donation of drugs, medical equipment, aids and essentials to the State Specialist Hospital, Okitipupa.
With this donation, I think this is another way of extending the service to others in the community who cannot afford to get the medications on their own.
During our needs assessment, we went to the hospital and we found out that they lack even the basic things, gloves, hand gloves, and a whole lot of other drugs. So we made a promise that we'll definitely come back to them, and whatever we have, we'll offer them. And that we've been able to do today. We offer them a whole lot of drugs and medical equipment and things, normal things that will be useful in the hospital.
Then we try to support the local clinic by donating most of the medications and the equipment they need.
This is free, so it's going to be donated to people too, dispensed to people at no cost.
Team heads of the When in Need Foundation, Dr. Kashmir Mwoga and Chukwuma Okere, confirmed that, apart from the contribution of medical items, follow-up on the patients will go a long way in sustainability.
The When in Need, we believe in continuity. So what we do in every community we visit is to liaise with the community health center or community hospital or whatever health facility they have on ground, so that after we must have gone, they continue.
Of course, we follow up to know the impact in the society. We follow up to know if they're actually using the drugs we gave them. We are following up to know the medications we gave out as gifts to the community, to their health centers, that they are not being sold, that they are actually being utilized properly.
These volunteer medics who have put in time, energy and experience in this 2-day exercise share their experiences.
During the course of the whole exercise, we discovered a lot of illnesses. We saw the pattern of diseases that are available, that are existing in this community. Predominantly, most of them are, some of them even have diabetes. Some of them are diabetic. They don't even know. They don't know. That's the first time of being diagnosed. The first time of knowing that their blood sugar level is so high. We are seeing blood sugar levels of 500 and something. That's quite high.
For every 10 patients we see, at least 7 to 8 will always come up with hypertension. And the funny part of it is that most of them don't even know that they have that.
Not only that, most of them also has a complicated issue of cataract, congenital cataract. And I was like, wow.
The last patient I just saw now, the little girl, she is 7 years old and she's having congenital cataract. I was like asking the mother what actually happened to the little girl's eye. She told me that the little girl was born like this and she had been having difficulty of what is actually the problem. But with this help of what we did here today, she was able to know what actually, that this is how the baby was born.
I like the major turn up of patients. I think it was given a wide publicity, which I like.
Most of them, this is an opportunity for them to have quality eye care services and other services.
With the hillside community of Okitipupa in Ondo State, Nigeria, now among the beneficiary communities of WIN, the brain behind this initiative, Chetachi and her team, are now strategizing on spreading the love to more regions.
I'm going to go back to the States so that I can begin channeling the next mission to Nigeria. We are going to come back and visit about 4 other states in about a month and a half. So I have my hands, I have my work cut out for me. So I have to make a run so I can go and work harder as I can so that I can still come back and bless some more people.
And then when it is actually expanding every day, reaching to all parts of the country, expanding to outside the country, within the West African coast and what have you. And believe you me, with time, with the cooperation of people like the man we met here today, who actually wrote and invited us to his community, I think we'll make a very big impact within the society where we live.
I am quite passionate when it comes to NGOs that are concerned about the welfare and the upliftment of humanity.
My eternal gratitude to the When in Need Foundation, Dr. Chetachi Ecton, for this rare opportunity and privilege for my people to be attended to medically.
I thank the person who brought the program and those who are helping to attend to people. We say thank you and God bless.